guys. Hello, good evening if you're in the East Coast. Good afternoon if you're in the West Coast or wherever you are in the world. Thank you for tuning in for this very important webcast with on prostate cancer and supplements. I want to thank Fullscript Natural Partners for putting this together. They're an awesome group and always willing to pass the word on how can we help men live longer and better, right? So thank you to Natural Partners and Fullscript. All right, I'm going to kind of just talk, okay? If you have questions, just go ahead and type in your questions there on your right side, and I should be able to see them. You can type them in whenever you want, okay? This is going to be a little bit of an interaction. I'm gonna kind of just go. I believe I'm prepared. The only reason I think I'm prepared is because all I do every day is prostate problems, and about 70% of that is prostate cancer. So if I'm not prepared by now, I think I'm in deep trouble. But the idea here is that if you are a practitioner, at least you can have a very good conversation with your patients with prostate cancer as to, take this, don't take that, etc. All right. So let's go. First of all, I need to disclose that I am a co-founder and formulator of XY Wellness. XY Wellness is a company for men's health, and we do have all kinds of things for male health issues, including prostate cancer. So I need to disclose that off the back. And there might be some things that I may say that are connected to XY Wellness, but I'm far from being a salesy guy. So if you want to learn more about them, just go right to the Fullscript website and go to XY Wellness, and you get to see everything you need to see. Most importantly, I want you to have a really good understanding of what you need to do tomorrow morning when that 58-year-old patient comes in and he says, I have prostate cancer, and what supplements do I take? What supplements do I not take? That's the most important thing, okay? And the other thing is that for the scientific geek out there watching, and you're going to want references for everything, I'm going to be posting references at my website, drgeo.com, drgeo.com. Right after, you'll have it by tomorrow morning. In terms of the references of everything that I'm going to say that I can reference to and cite. Okay, so I'm going to have it all out there for you. All right. All right, supplements for prostate cancer. I guess the best way to start is, do we need supplements? So here we have a guy, with prostate cancer, and let's not get into the weeds with regards to, the type of prostate cancer, the stage, the PSA, the Gleason score. I could talk about that a little bit as we move along, but let's just say, guy, 58 years old, I have prostate cancer. What should I take? What not to take? Or can I just get everything from food, right? Can I just get all my nutrients and phytochemicals from food alone? And actually, that may be my preference as a patient, right? So here's my answer to that. First of all, there are four. Okay, let me come back. What we're trying to do, from my perspective, and I've been doing prostate cancer about 15 years, and now I've seen probably over 2,000 prostate cancer patients within that time. So I have a little bit of experience and just a lot of research, and I'm in the midst of writing my second book on it. So this is all fresh, hot off the press, right? Do I need to use dietary supplements? I rather get all I need from food. Okay, what we're trying to do from a cancer and prostate cancer perspective is create a microenvironment that's hostile to cancer. So many of you would know this as, I'm treating the terrain, if you will, right? That is the goal. So there are 5 things I'm trying to do, 5 mechanisms that I'm trying to accomplish with everything, my naturopathic protocols for prostate cancer. I'm trying to accomplish 5 things. Number 1, reduce chronic inflammation, right? Number 2, stimulate the immune system, strengthen the immune system, particularly the NK natural killer cells and T cells. Those are the ones that are known to seek and look for cancer and get rid of cancer. Number three, I'm trying to protect the body or the cells from oxidative stress. Number four, detoxification, right? So if possible carcinogens come into the body needs to do a really good job to get rid of these carcinogens, right? So detoxification. The liver, crucially important. We need a strong liver, right, to detoxify. And number five, we need to manage insulin and blood sugar levels, right? Manage insulin and blood sugar levels that can lead to development and progression of prostate cancer. So those are the five things we're trying to do. If that's what we're trying to do, there's four elements to that, at least in my program, right? There are four elements. One, food, what to eat, what not to eat. Number two, exercise. Number three, sleep, not only quantity, but quality, right? And number four, dietary supplements. If I have to choose, if I don't have a choice, right, and I have to choose 3 out of 4, then I would leave out dietary supplements, because I do think that in order for for a man to overcome and live their best life after prostate cancer, they need to have good food in their system, they need to exercise, they need to sleep well. But I would say dietary supplements is, I mean, asking me which one is more important, out of the four elements, which one is more important to you? It's almost like asking me which one of your 3 kids do you love the most, right? You know, that's hard to say, right? And the answer should be, I hope, I love all my 3 kids the same. All these 4 things, all these 4 elements are very important. So that being the case, can I get everything from food? The answer is no, you can't get everything from food. Why? Because number one, you can't get really good vitamin D from food, right? You get a little bit from sunshine, but you have to be out naked, you know, almost naked under the sun. Some people are at a higher risk of skin cancer. You can't really get vitamin D from the sun. And, you know, you can get it from some foods, but not that much. So that's an example. Some of the phytochemicals like curcumin, yeah, you could get from curry and things, but not at significant doses, right? Our food system is depleted. Even, I mean, look, if your patient is eating local and organic food and local, and that's all they eat, I would still say they need a couple of supplements still. And that's the person that's eating. I'm not saying the eating organic. I'm saying eating local, right? Because when I go to Whole Foods, the apples that are organic that are there on the table, they come from New Zealand, right? Nothing against the Kiwis. Love my Kiwis. The fruit and the people. Love my Kiwis, right? But by the time the apple is harvested and taken, you know, and brought to the US and exposed, it loses a lot of its nutritional value. And that's an organic apple, right? So, no, you can't get everything from food. If you are serious about living your best life after prostate cancer, and I'm not mincing words here, I do believe, based on all the experience that I have, that your prostate cancer patient can take this diagnosis as an opportunity and not only live, but live optimally. With some exceptions to that rule, if they undergo certain conventional treatments, then they're going to probably have sexual dysfunction. Okay, so that's not optimal for many men, not for all men. But all things considered, they can live an optimal life and strength and be functional and work and spend quality time with family and friends that they have. So that's my definition of success. That's what I'm looking for. I'm not looking only for longevity. I'm not looking with my prostate cancer patients how not to die. I'm looking for how do I live, how do I not only not die, but also how do I live my best life, right? That's the goal. All right. So we're trying to address those 5 things that we mentioned before. So you can't get everything from food, in my opinion. I could get pushback on that. I know that the purists and the foodists are you know, they're out there. I see them on social media. Sometimes they call me out. I don't think you can get everything from food. And maybe I'm also a big supplement taker. I don't mind. I could take, you know, a bunch, 20, 25 at a time. So I don't mind. So that's that. All right. Now, what is it that the prostate cancer patients should take? What is it that they shouldn't take? And here's why. Okay, let's start with all right, let's start, and some of these things are controversial and I'm going to clear it up. Let's start with antioxidants. Should they or shouldn't they? Because you've read likely that certain antioxidants increases the risk of prostate cancer, primarily vitamin E and selenium. Okay? You've read that. And your patients are coming to you and saying, well, why am I on vitamin E and selenium when here's a paper and I read on the internet that it increases the risk of prostate cancer? All right, here's the deal. Every controversy with regards to vitamin E and selenium is coming from one study called the SELECT trial. The SELECT trial. SELECT, S-E-L-E-C-T trial. You Google that, you're going to have a lot of information on that. The SELECT trial tried to study. It was a randomized trial. There was over $100 million spent on this trial. It was about 400 institutions that were involved. Columbia University here in New York was one of them. I was involved in a SELECT trial as a researcher at Columbia, recruiting patients and cutting their toenails to send it out for it to measure selenium in toenails on the SELECT trial. Anyway, so here's the deal. The SELECT, and I'm going to summarize. The SELECT trial lasted about 7 years, supposed to last longer, but they stopped it because there's two things that happened. Number one, they didn't show that vitamin E and selenium protected men, undiagnosed men, from prostate cancer. But then further research showed that, wait a minute, maybe both vitamin E and selenium can increase the risk of prostate cancer. Oh, shoot. All right. And so when I was looking at the protocol, the design back in Colombia, this is now 15 years ago, I was like, this has to fail. Why? The type of vitamin E that they use on the SELECT trial was alpha tocopherol, right? Alpha tocopherol. Why did they use alpha tocopherol? Well, because the study that was conducted in the mid 1980s to late 1980s called the alpha tocopherol beta carotene trial, the ATBC trial, looking at a large population of people of smokers and seeing if these two nutrients protect smokers from cancer, from lung cancer. That study showed, and it was alpha tocopherol and beta carotene. That study showed that it didn't protect people from lung cancer. In fact, beta carotene increased the risk of lung cancer, according to the ATBC trial, and among smokers anyway. But the vitamin E group, the alpha tocopherol group, it reduced the risk of prostate cancer by 32%. By 32%. Then you have the NPC trial that looked at selenium and looked at to see this selenium yeast that contain selenomethionine, also selenocysteine, and there's another 3 types of selenium. It was a yeast, it's like a brewer's yeast type of selenium. It showed that it reduced the risk, and that study was published in JAMA in 1996. It showed that this type of selenium reduced the risk of prostate cancer by up to 60%. So then came the SELECT trial, late 1990s, early 2000s, to see if indeed vitamin E and selenium protected against prostate cancer. All right, let me get to the point because this is only 2 nutrients and I have way more to talk about, and I'm not sure that we have that much time. All right, but this is important because, and again, it's going to be on drgeo.com, drgeo.com. This is important because your patients are going to question you on this. Okay, takeaway. SELECT trial looked at, it used 400 units of alpha tocopherol, not gamma, not mixed, alpha tocopherol. not 50 units like it was used at the ATBC trial, right? So it used 8 times more alpha tocopherol than the original trial that showed there was a decrease in prostate cancer development. And the selenium that was used in the select trial was selenomethionine, not the brewer's yeast with all the compounds of selenium that likely has synergistic value. Okay, so what do we know from that? We know that, number one, gamma tocopherol is very important to keep out. Yes, alpha tocopherol has anti-carcinogenic properties, but it needs the help of gamma tocopherol, which without gamma tocopherol, which I typically recommend high gamma tocopherol vitamin E, you need gamma tocopherol to really have anti-prostate cancer benefits. So that's vitamin E. And you need 400 units of mixed tocopherols with high gamma tocopherol, not just one type, not just the alpha tocopherol. With the selenium, the best form is the selenized yeast form that was used in the NPC trial. Okay, so takeaway. No, vitamin E does not increase the risk of prostate cancer, nor does selenium if the right version is used. The right version is high gamma tocopherol, maybe mixed tocopherol, vitamin E, and selenized yeast, not just selenomethionine. Now, I know there's a lot of selenomethionine in many of the supplements that we prescribe for people with thyroid dysfunction and things like that. In men, particularly in men with high risk of prostate cancer, I do not ever recommend selenomethionine, ever, okay? I do recommend selenized yeast produced by SelenoXL, okay? So any formula that has a prostate formula should have selenized yeast if it has selenium at all, okay? So that's the takeaway with vitamin E and selenium. You want high gamma tocopherol, that's protective, and you want high selenized yeast, not just selenomethionine. All right, again, if you have any questions right there on the right, write them in, and I'm gonna read them as we go. All right, let me just get a quick swig of water. It's hot here in New York, very humid. My AC, this is my office, and I don't have an AC in my office here. Anyway, all right, so that's that. Folic acid. Big studies showed that 800 micrograms of folic acid in a randomized trial so that it increased the risk of prostate cancer significantly, particularly advanced prostate cancer. This study was published a long time ago, way before our friend and colleague, Ben Lynch, started talking about MTHFR mutations, right? So here's the deal with that. Clearly, I think that particularly now, that the reason why folic acid increased the risk of prostate cancer in some patients is because of this MTHFR mutation, which you should measure if you're a practitioner. Okay, I do recommend natural folate. Actually, let me take that back. I don't necessarily recommend natural folate unless I have to recommend it. I recommend other things. Do you recommend? So do you recommend folic acid or folate? I've learned that folate is better. Okay, so yes, folate is better. I don't recommend it because I'm not sure. There's a lot of things to recommend if a patient has prostate cancer, and I don't recommend it because unless they have a deficiency or they have folate deficiency anemia, or there's a reason for me to recommend it. I do recommend it in my male infertility patients, but it's natural folate, never folic acid, ever, ever, ever. Okay, Brenda, yes. So that's that. I don't recommend folic acid or natural folate, but you may, and it has to be natural folate if you do. Zinc, right? So zinc is the other mineral that a lot of it is found in the prostate, and they've looked at studies, and there's been a correlation with low zinc in the prostate in men with prostate cancer. Does that mean that first of all, does it mean that you need zinc? And number two, does it mean that Well, let me say this, another study, and I'm going to have these references at drgeo.com if you guys are interested, drgeo.com. Another study looking at humans showed that 100 milligrams or more of zinc increase the risk of prostate cancer. Okay, so what do you do with that information? Well, with any mineral, by the way, selenium included. I think that selenium, any mineral, selenium, zinc, uh, um, um, magnesium, too much of any mineral is a problem. And it can cause all kinds of dysfunction and imbalances. We do know that after about 30 to 60 milligrams of zinc, you need maybe 1 or 2 milligrams of copper, number one. Number two, um, I never really go higher than 30 milligrams of zinc ever anyway, all right? Certainly never even close to 100 milligrams. So zinc, yes, is important. You don't want to do more than 30 to maybe 60 milligrams. The higher you go, you're going to need more copper in that. A little bit of copper, because too much copper actually is carcinogenic. So you want to be careful with. And you want to, part of your blood test should be, by the way, red blood cell selenium and zinc. You should measure zinc in patients. Okay. What else? Vitamin D. So vitamin D is, by and large, most of the research suggests that vitamin D is protective against prostate cancer. Okay. I typically have my patients at around 40 to 60 nanograms per milliliter, so I check their blood. Roughly, I give them about 5,000 units a day of vitamin D. Okay. There does seem to be some carcinogenic activity in vitamin D. What form of zinc do you use? First of all, I use it in a formula, and I use anything zinc picolinate or zinc citrate, one of the two. Okay. So vitamin D, it's important at about 5,000 units a day. For most, it depends on weight and this and that and the other, and the bigger they are, the more they need. Yes, yes, yes. But I find that 5,000 units a day is a very good starting point, and they might need more, they might not. Most research suggests that it is a good thing. Some research that are dubious in terms of design suggests that it might not be a good thing. With every nutrient, you're going to get both, right? And you have to look at not only the research, but you have to look at the preponderance of research and see, how it all compares. That's why I don't know how you guys do it. I know a lot of you guys are, generalists, and you see everything. I have no idea how I can barely keep up with with prostate issues and male hormones and things of the sort. I could barely keep up. So I don't know how you guys do it. Anyway, so that's vitamin D. Fish oils. About Dabrowski, he's a researcher, published at the Journal of Cancer Institute, published a study that showed back up there in Seattle, in Hutchinson, from the Hutchinson Cancer Research Center, showing that, and this was maybe 2012, 2011, 2013, right around that time. Again, I'm gonna reference it on drgeo.com. That fish oils may increase the risk of prostate cancer. The omega-3s, EPA, DHA, all the other omega-3s may increase the risk of. So your patients, again, because I get asked all the time, doesn't fish oil increase the risk? You're recommending fish oil, doesn't increase the risk? Here's what happens. They looked at old research and blood samples from one of the trials. I think it was a PCPT trial. They look at and so they looked at the blood samples again, and they noticed that, hey, in this old blood sample, higher omega-3s, higher omega-3s, those with higher omega-3s had higher stage of prostate cancer. What a bad study was that was. First of all, it wasn't it wasn't randomized. It wasn't even a prospective study, right? It was kind of retrospective. It looked at old blood samples and specimen, and to see if there was omega-3s in it, and it compared with prostate cancer staging. That was very bad. Even conventional doctors, these are these are doctors that don't know much about functional medicine, naturopathic medicine. Urologists, oncologists looked at the research and said, I can't believe this was even published. Takeaway. One of the things we're trying to do, again, is reduce inflammation. For me, there are three things that do a great job in reducing inflammation. One is fish oils. Fish oils, reduces the prostaglandins that you don't want, that are involved in the inflammatory response. And fish oils is excellent. The other is curcumin, and I actually like boswellia. Hold that thought. We're going to talk about curcumin and boswellia in a second. But fish oils, I use about 4 grams a day, 4 to 6 grams a day with patients, of particularly omega-3 fatty acids. So I do use roughly about 4 to 6 grams of omega-3 fatty acids. Why? Well, I'm trying to lower inflammation, right? And if I can lower inflammation in these patients, number one, I will create this microenvironment hostile to cancer cells. Number two, I'm never forgetting of the big picture with my prostate cancer patients. What do I mean by that? So when this 58-year-old guy, 62, whatever age, comes in, I have prostate cancer, I'm still looking at the bigger picture. I want to make sure that they don't die prematurely, not only from prostate cancer, but from anything. The number one cause of death in men with prostate cancer is heart disease, is not prostate cancer. And these men are, depending on treatment, depending on many things, they are at risk of secondary cancers. They are at risk of heart attacks. They are at risk of Alzheimer's. They're at risk of all these things that most men are at risk of. So I asked them, I said, look, let me make sure I understand. I know you don't want to die from prostate cancer prematurely, but you probably don't want to die from anything prematurely. Do I have that correctly? And of course, I'll say, yeah, of course, so on. So I'm always looking at, yes, prostate cancer, and we want to reduce PSA, and we want to do all these wonderful things to make it a hostile cancer environment around the prostate. Yes, but we also want to make sure they don't die from anything, other things like heart disease. So 4 to 6 milligrams of fish oils, that provides some cardiovascular benefits. By the way, a study published in JAMA not that long ago showed that men who take fish oil, not only, I'll say men who take fish oils who undergo surgery. So every surgeon would say, and I have said to patients many times, stay away from fish oils, right? So it showed that men, not men, people, both genders, who took fish oils and then had surgery for whatever reason, it didn't interfere with the surgery. They didn't bleed more profusely or anything like that, and they actually had better outcomes compared to those that didn't have or take fish oils. So there's something interesting there. I'll put that link on my website again. All right, so fish oils, 4 to 6 grams a day, and that could be a lot of pills. That could be 2, 3 soft gels, and I know patients will say, "Well, those are horse pills." All right. So and again, I'm the messenger. I give for some patients that have a hard time swallowing pills, so that may be a reason why they wouldn't want to take the horse pills that they call with fish oils. Do you use a particular ratio of EPA DHA? Yeah, so my ratio is about 600 EPA to about 400, 300 DHA. So it's always more EPA, about, I don't know what the ratio is. It's not 2 to 1. About 1.5 to 1, roughly. Definitely more EPA. All right. What are the botanicals? All right, what are the botanicals I use? All right, I use grapeseed extract. because grapeseed extract has shown in a study that it can significantly reduce the risk of prostate cancer. They looked at a group of men who took all kinds of supplements, glucosamine, lycopene, and so on, and showed that only grapeseed extract, only those who took and consumed grapeseed extract had a lower risk of prostate cancer. And again, grapeseed extract protects against oxidative stress, or at least that's the mechanism of action that I think that works. So grapeseed extract, really, really important. Curcumin, all right, curcumin. Curcumin is one of the main botanicals that I think should be used. Here's the deal with curcumin. I'm trying to gather because I use a lot of curcumin in different dosages in different scenarios. Okay. In men that do not have stage 4 metastatic disease without pain, in those type of men, I use about 1 to 2 grams a day. Again, these are men that have maybe stage 1 or 2. Prostate cancer is not metastatic. They don't have bone pain, etc. I use about 1 to 2 grams a day of curcumin, give or take. So I usually use a formula. One of the things that we use at XY Wellness, again, you can find that at Fullscript and Natural Partners. I use a formula, plus sometimes I use additional curcumin in that situation. I don't use, so as you know, there's the curcumin wars out there, right? Which one is best? Is it Mariva? Is it BCM 95? Is it C3 curcumin complex? Is it Longevita? Right? All these, and they all promote that, mine is better than the other because it increases absorbability, because curcumin is not that absorbable by itself, right? So you need to have it mixed with something else. So one of the methods of mixing curcumin with something else, that something else is piperine, right? Pepper. You don't want to use piperine with curcumin. You don't want to use that format. And I know a lot of you do, and I have quite a bit in the past. Why? Because it inhibits glucuronidation. So that means that your body cannot use that system, that method to detoxify. So that means that there's if your patient is taking certain drugs, for example, there's more of these drugs lingering in the system as a result of inhibiting glucuronidation. So it stays in the system for a longer period than what it needs to be. It can also piperine can inhibit the body from getting rid of xenoestrogens, which I believe that prostate cancer is a both internal environment and external environmental problem. I think most cancers are environmental, both internal and external, environmentally induced. So you want to make sure that, again, one of the elements that we spoke about of how we want to create this microenvironment hostile to cancer cells is by detoxification. Well, piperine inhibits that process. So I don't use curcumin with piperine. I do use curcumin, let's say, mixed with sunflower lecithin, as opposed to soy lecithin, for example. Okay, so that's that. Maybe in other patients that are not, I'm not sure. I mean, I know that some of the compounds that are combined with piperine, I know that it helps with pain, for example. So, that's fine, but I don't use that in my prostate cancer patients. Again, I use my curcumin with, that's combined with sunflower lecithin. What dosage of grapeseed extract I use? I use about 100 milligrams a day to 200 a day, roughly. Curcumin. In my patients who have more aggressive disease, metastatic to the bone, now they're experiencing pain, I do give them 4 to 6 grams of curcumin a day because there is anti-inflammatory properties in curcumin and it can help with pain. And again, in those patients, I do give them about 4 to 6 grams of omega-3s. I started using CBD for pain. I don't have a lot to say about it yet. I know that people are using CBD as an anti-carcinogenic compound. I don't have a lot to say with regards to prostate cancer anyway. I know that people are reading things all over the internet that CBD has anti-cancer properties, and a lot of my patients come back and say, look, I started taking CBD. I have no problem with it. But I don't have a lot of, I don't have anything to hang my hat on. But I can say that CBD oil can help patients with pain. Again, I just started using CBD oils not that long ago, so I think it's a reasonable approach, particularly with men with stage 4 prostate cancer that are experiencing pain. Okay. Oh, sorry, really thirsty. All right. Boswellia. So Boswellia is a botanical, Indian botanical that it's in many joint formulas. Let me be clear. I just spoke about CBD, and I want to make sure that it's not joint as in marijuana. Joint pain like in your joints, right? Your leg joints, your lower extremity joints, etc. That's where you find Boswellia more often than not. Boswellia is an excellent anti-inflammatory botanical, and some research shows that it has anti-cancer properties. So I use Boswellia quite a bit. Again, it's in a formula, might be 200 to 400 milligrams a day of that. I try to give my patients 2 or 3 formulas, particularly my prostate cancer patients, 2 or 3 formulas that work well, as opposed to giving them 15 bottles to open a day. Okay. It just becomes exhausting for patients. And then they still have to eat right and extra, it's just exhausting. So I want to make it so that it's effective, and I also want to make it so that I don't set them up for failure, so that they succeed in the protocol and in the program. So that is that. So Boswellia, right? I use modified citrus pectin. Okay, so there's some good research showing that modified citrus pectin can help men who have a recurrence of prostate cancer. What's a recurrence? They have prostate cancer, they get their prostate cancer treated, maybe surgery, and now their PSA is rising again, even after surgery. So that means they have a recurrence of prostate cancer. So modified citrus pectin is great in that scenario. Modified citrus pectin is great in men undergoing a prostate biopsy, because it can protect the body against spreading of cancer, particularly prostate cancer, right? It has a galectin-3 molecule that kind of protects, it doesn't allow the cancer cells to kind of cling and claw to different parts of the body where now they can move. So that's modified citrus pectin. I know that a lot of my patients take about 5 grams 3 times a day, and I think that that's what's recommended typically. I don't recommend that. I recommend about 1,200 milligrams a day, and I think that works very well within a formula as opposed to separately. Why? Well, I think 5 grams a day, 3 times a day is fine. The other thing is that I haven't seen an escalation trial showing that that's the dosage that's important. So I have not seen that. Maybe in my patients with more advanced disease, that's the case. So I use about 12 grams. Plus, when you use a lot of modified citrus pectin, in many patients that causes digestive problems and sometimes even diarrhea at 5 grams 3 times a day. Okay. All right, that's modified citrus pectin. What else? I already said that I use vitamin E in terms of antioxidants. I use vitamin C. I use zinc quite a bit, alpha lipoic acid. So I like the mixture of antioxidants because they kind of work together very well. I use that. Some people do IVs of vitamin C. There again, I have no data to support the use of IV vitamin C at large dosages, 20, 40 grams a day. I do um, I do encourage people that ask me and they say, "Hey, I could get IV vitamin C drips here in a local natural doctor here," and I said, "Well, go for it." But I don't have any research to support that it's good for prostate cancer. There's some research to support that it's good for kidney cancer and other types of cancers, but I'm not sure about prostate cancer. So, but I do have my patients take oral vitamin C, and the reality is that the body cannot absorb more than about 500 milligrams of vitamin C at a time. So I know when people take 2,000 milligrams, the body cannot absorb more than 500 milligrams. Now you could take 500 milligrams every 2 to 3 hours. In fact, that's what I do during flu season. I take 500 milligrams of vitamin C every 2 hours or so. But your body cannot absorb a whole lot more than, and then too much vitamin C, of course, can cause softening on the stool, and that will tell your body to back up a little bit. I use broccoli extract, right? So broccoli extract helps in detoxification, and particularly phase two. By the way, a lot of these nutrients helps in phase two detoxification. So again, we want to help the body detoxify. So I use broccoli extract. I think that's very, very important. Plus, broccoli, the sulforaphanes and so on, has anti-prostate cancer activity. So that's very important. I use that. I use milk thistle, right? I use milk thistle because milk thistle is an excellent liver botanical, and we want to make sure the liver is healthy. That's one of the goals. Why? Because the liver really, when you see advanced cases of cancer, not just prostate cancer, liver failure is a component or of when patients do poorly. A strong liver is very important, so we want milk thistle in that mix. I use schizandra, another great liver herb, schizandra. So between schizandra, milk thistle, and broccoli extract, that gives me a lot of what I need to support good liver function. Okay. Um, what else? What else? I do use medicinal mushrooms. I use well, the main formula, the main type of medicinal mushroom that I use is reishi mushroom or Ganoderma. I know there's quite a few different ones. There's Coriolis and all kinds of different mushrooms that are medicinal and helpful. From a cancer perspective, and plus from a prostate cancer perspective, I think the research is it's pretty much overwhelming with regards to supporting that you want to use Ganoderma or reishi mushroom. That is the number one. If you use a mixture of mushrooms, that's fine. That's fine. I have my patients use a good protein powder, plant-based protein powder. Actually, Designs for Health has it, called MycoPure, and that has mixed mushrooms in it along with protein from plant-based protein. So that's what I use there. But for in a formula, I use Ganoderma, I use reishi mushroom. I think that's the most important mushroom if I have to choose one. And I think that the research with its ability to stimulate the immune system, particularly T cells and natural killer cells, it's pretty good and overwhelming actually. So that's that. I do use active hexose correlated compound, AHCC, particularly in moderate stage to advanced stage prostate cancer. Not necessarily in low stages because number one is costly. Number two, I want to make sure they take all these other things that I think for their particular stage is important. So, what you recommend at different stages matters quite a bit. What else? I use a lot of adaptogens. Oh, well, let me say this. So some of the patients that you can see with prostate cancer, they're undergoing hormone therapy or androgen deprivation therapy where they get chemically castrated. Now they have no testosterone. Okay, there are three things that happens in that scenario. Number one, bone demineralization. So they start developing osteopenia that develops into osteosporosis because you do need testosterone to keep your bones strong. Actually, men need estrogen for that purpose as well. They develop cognitive decline, so the memory goes kind of not, down the drain a little bit. And they can develop metabolic syndrome. So I have them in a very aggressive dietary protocol, exercise, and certain nutrients to prevent particularly cardiovascular disease and all these things. These are men, again, these are men undergoing hormone therapy, androgen deprivation therapy, things like Lupron, things like abiraterone or Zytiga or Zanti, also known as enzalutamide is the generic name. So part of the goal there is, yes, continue to create this microenvironment that's hostile to cancer cells. The other thing is trying to offset some of the side effects of the hormone therapy. All right, so for cognition, I use primarily two things: Bacopa, which is a botanical, Indian botanical as well. I also use acetyl L-carnitine. You get a double whammy, a double benefit there. You get the cognitive benefit from acetyl L-carnitine. You also get the cardiovascular benefit for acetyl L-carnitine, so that's good. I use CoQ10, okay, for cardiovascular benefit. I use calcium and magnesium. I use that, and of course, you want to, they have to exercise, but I do use some calcium to make sure that they have good the calcium for bone health. I use a calcium malate or calcium glycinate or with magnesium citrate or malate or glycinate, whichever one. Actually, calcium citrate malate is what I use, and the magnesium is could be glycinate or malate. Okay. I use adaptogens. So the category of botanical called adaptogens. I use a lot of adaptogens. Rhodiola. Oh, the other thing that they experience, these guys on ADT, they experience fatigue, right? So the adaptogens helps with fatigue, just like CoQ10. CoQ10 is an excellent nutrient for mitochondrial function. One of the things that you can see in prostate cancer, like you can see in many other diseases, is mitochondrial dysfunction. So you can use ubiquinol. As of late, I mean, I still use some of the regular ubiquinol. As of late, I've been using a lot of what's called MitoQ, which is a certain type of ubiquinol that a lot less is needed. About 20 milligrams is needed for it to do and get into the mitochondria. So, but I use both. I still use both. Vitamin C liposomal. So liposomal. There's a lot of so let's see, what am I trying to say? All right. From a dietary perspective, choline has been associated with advanced prostate cancer. Choline. Now, choline is a nutrient. Choline is a very important nutrient. You can't do well without choline. You can't think well without choline. It kind of have the choline helps the neurotransmitters talk to each other in your brain. You need choline. But maybe too much choline too much of a good thing is a bad thing, and that's where choline, or too much choline may be a problem. So I don't use phosphatidylcholine, which is a typical nutrient found in a lot of these cognitive formulas. I don't use phosphatidylcholine in my prostate cancer patients or those that have high risk of prostate cancer. The liposomal, a lot of the liposomal compounds, I'm not sure. So I don't use liposomal. Let me answer the question. Okay, I use ascorbic acid, which is what's been used since Linus Pauling. Not sure that vitamin C liposomal is a much better, and I have some thoughts and concerns about the liposomal in terms of safety, particularly with prostate cancer patients. Is broccoli extract similar to DHT blocker? I don't believe it is. So broccoli extract is not a DHT blocker. It's not. No. Um, DHT blockers are typically 5-alpha reductase inhibitors, so you prevent the conversion of testosterone to DHT, and broccoli extract is not that. What was the name of the Indian herb you just mentioned? Bacopa, Bacopa. I think it's great for cognition and memory, and I think it's, it competes up there with ginkgo, and my opinion, probably better than ginkgo. So that's Bacopa. All right, and so whoever has questions, bring them in, because I'm about to wrap it up. So start sending your questions, and I'm about to wrap up the whole this webinar. Some quick takeaways. So we said adaptogenic herbs. I like rhodiola quite a bit. I like ashwagandha. I like Siberian ginseng. Again, this helps men who are undergoing ADT with fatigue. Okay, helps them. And there seems to be anti-carcinogenic activity with some of these botanicals as well. So that's an extra benefit. I think that is it with regards to supplements. Again, the goal here is that the takeaway is this: you do need dietary supplements, in my opinion. Food, you can't get everything from food, okay? But food is most important, as is exercise and sleep, okay? The supplements you use matter. You cannot overwhelm them with 15, 20 bottles a day. I don't think that's helpful, and I think that's just that's just they're gonna get exhausted from all the pills. So don't overwhelm them. You want to make sure that you get liver health, milk thistle, milk thistle, schizandra, good, nice combination of antioxidants. Curcumin, again, not with purpurine, I would say more with sunflower lecithin, which helps with absorption as well. And so that's how you create this microenvironment hostile to cancer cells. At the same time, you want to be able to offset some of the side effects of some of the treatments. By the way, men undergoing external beam radiation for prostate cancer, they can and should be taking certain supplements, and likely if the radiation oncologist gives you a little pushback, no supplements, at minimum, they should take curcumin, because studies show that it helps men undergoing radiation for prostate. Helps how? The cancer cells become more sensitized, so that the radiation targets the cancer cell better, and there's less side effects from the radiation in those that take curcumin. So men undergoing external beam radiation should take curcumin. There's data to support it. I'm going to post it on drgeo.com by tomorrow morning, actually. You'll see it there. All right. I see a couple of questions coming in. Do you use vitamin K with calcium? Yes, I do. I use vitamin K2, menaquinone. And I use vitamin K2 for bone health. That's a very good question, along with calcium. This was very informative. Thank you. My pleasure. Thank you for tuning in. Do you have an opinion about pomegranate juice or prostate cancer? Okay, good question. So I do use pomegranate extract in one of the formulas that I call the 1-2 punch, found at Fullscript through XY Wellness, or found through Fullscript from XY Wellness. And disclosure, I'm co-founder and formulator for XY Wellness, so that's my disclosure. Do you have so I do use pomegranate extract. Pomegranate juice I do use. However, 8 ounces yields 32 grams of sugar in an 8-ounce jar of pomegranate juice. That's a lot of sugar, 32 grams. Remember, one of the five things we're trying to do is lower insulin response and blood sugar, right? By the way, you can use berberine as well if patients have high blood sugar levels and you want to control that. I am a fan of metformin. You can use metformin. In fact, studies show that metformin has a bunch of anti-prostate cancer properties. So metformin, good drug. It's an excellent drug, 500 milligrams twice a day. But I use berberine, which works very well in managing blood sugar as well. To answer the question, pomegranate juice, I use pomegranate extract in as a supplement, and I give them permission to drink pomegranate juice only about 2 to 4 ounces at a time, mixed with diluted a little bit. I have them have a little club soda and make it a fizzy for them or whatever. That's what they choose to do. But you want to be careful with the sugar content in pomegranate juice. Thank you very much. Thank you. Thank you very much. I appreciate the compliment. What do you think of Artemis? Okay, wormwood. So artemisinin, I think it's fine. I think it's a very good botanical. I don't use it, okay? No, for no reason, okay? Wormwood is an excellent antibacterial, excellent anti-parasite. A lot of patients have, unwanted, unneeded, and one can make the argument just like certain bacteria that are associated with ovarian cancer. If you look hard enough in the literature, they associate certain bacteria and things to parasites, even to prostate cancer. So wormwood is fine. I don't use it, but I think you can. It's a very good botanical. Thank you for answering my question. Thank you. Have you tried Budwig protocol of cork tree? Okay. The Budwig protocol is cottage cheese with flaxseed oil kind of concoction, and then that's what you eat. It was by this lovely German lady who treated prostate cancer long, 80 years ago, 60 or 70 years ago in Germany. I don't use that. Flaxseed oil can promote prostate cancer, maybe because it gets rancid very easily. First of all, that's a hard protocol to keep up with. Nobody, just like Gerson, right, where you have to take 10 juices a day and do, 3 to 4 enemas. It's very difficult to do, and I just don't think my prostate cancer patients need that. Certainly, the Budwig protocol is not what I promote. If you stay in touch through drgeo.com, that's drgeo.com, I put all my protocols up there, and a lot of it will be in my next book that's going to come out early 2020 on prostate cancer. All right, thank you very much. Thank you. Very informative. I love that. What is your take on saw palmetto? So saw palmetto does not have anti-cancer properties. I don't even use a lot of saw palmetto for BPH patients that much either. So I don't use saw palmetto at all. And in other benign prostate issues, I just don't see that it works as well as other things. So I don't use saw palmetto at all, particularly for prostate cancer. All right, guys. Well, listen, I'm signing off. It's 9 o'clock here p.m. in New York. I'm signing off. Thank you so much for tuning in. I can't tell you how much I appreciate you taking time off to tune in. Stay in touch. Make sure you stay in touch with our friends at Fullscript and Natural Partners. These guys are absolutely awesome, and they have such an easy system for us to be able to prescribe supplements to our patients and make sure that they're compliant. So make sure you're in touch with them. All the XY Wellness supplements that I'm a part of you can find it through Natural Partners and Fullscript. So I hope this was informative. Many of you said that it was. Thank you so much. Have a great night and talk to you soon. Be well.